take the history and physical examination, and we will put the patient diagnostic elimination of cow milk protein. After you label patient or you confirm your diagnosis, you will go to the treatment. The strict avoidance of cow milk is presently the safest strategy for managing cow milk protein allergy. Types of formula: we have regular formula and partially hydrolyzed formula, extensive hydrolyzed formula, elemental formula, amino acid based formula. Let us start with the regular formula. This is the regular formula. Every child is taking this formula. The partially hydrolyzed formula, mainly we have the problem we have three macronutrients in the milk. We have fat and lactose. We mentioned lactose, they will have diarrhea since birth if it is primary lactose, or protein. The main protein we have either now in the market only cow milk or goat milk. So that if it is cow milk, which is the common here in our country, we have partially hydrolyzed formula. Still we have little lactose, but the peptide itself, it catalyzed or hydrolyzed to less than 3,000 at the molecular weight, less than 3,000 atomic mass. If it is extensive hydrolyzed formula, this is the time to have the molecular weight less than 1,500 Dalton atomic mass and devoid of lactose. All the formula of extensive hydrolyzed formula not containing lactose. I think one or two having containing lactose. The benefit here, if you have cow milk protein allergy and you are using extensive hydrolyzed without lactose, they are adding glucose polymer instead of lactose, but your patient not having lactose intolerance. So that if you are using lactose, no problem. But the main issue you have, the protein is hydrolyzed. The elemental formula only from the elements, which is the amino acid. We have multiple brands in our country. Right. Duration of treatment. Regarding the therapeutic formula, at least used for at least 6 months or until 9 or 12 months of age. You can see, once you label your patient as real cow milk protein allergy, you should continue for 6 months or until he reach 9 or 12 months of age. Which one you choose, it is not much difference, because this is most likely moderate reaction. Why we mention this? Because sometimes the sensitization, it will not appear as we mentioned with delayed reaction, it will not appear immediately. It will take time. Maybe they will present to you at 2 months of age or 3 months. Rarely they will present later on because of the viral illness or gastroenteritis. It is the trigger for the cow milk protein. Now, regarding the infants, children with severe immediate IG-mediated reaction may remain on the elimination diet for 12 or even 18 months before they are rechallenged. Like food protein proctocolitis, as we mentioned, lethargy and pallor and vomiting. So that he is 12 months before rechallenge, he is 6 months. If it is moderate reaction or simple cases, 6 months, fair enough. If it is more than, we should at least 12 months put the patient on the specific formula with avoidance of cow milk. Something to mention about if you have your patient with static weight or poor weight with vomiting. Sometimes you will think this patient having gastroesophageal reflux disease. In the NASPGHAN guideline, before you are using PPI or label your patient as gastroesophageal reflux disease, you should start trial of cow milk protein allergy for 2 weeks. Then, if the vomiting continue, you can think about of trial of PPI. After that, pH monitoring and endoscopy. Now, the evaluation. Challenge with cow milk may be performed after maintaining therapeutic diet for at least 3 months. For example, specific IG negative, mild symptoms. They mention 3 months for these, but think about it, 6 months and 12 months only. Up to at least 12 months, for example, high positive IG test and severe reaction. If a challenge positive, then the elimination diet is usually continued between 6 and 12 months. Up to 2 years, we can continue the elimination diet. If the challenge is negative, the cow milk is fully reintroduced in the child diet, so that we can introduce the yogurt, the cow milk, everything. Any question? Okay. Thank you.